Hello, everyone, and welcome to our fifth and final day of the NIC.br Annual Workshop on Survey Methodology. And this year's theme is Artificial Intelligence and the Future of Data Production. This series of webinars is organized by the Regional Center for Studies on the Development of the Information Society, Cetic.br, which is a department of the Brazilian Network Information Center, NIC.br, and is co-organized by the National School of Statistical Science linked to the Brazilian Institute of Geography and Statistics, IBGE. I'm Tatiana Gereissati, coordinator of sectoral studies and qualitative methods at Cetic.br, and today I will moderate this webinar together with Alexandre Barbosa, head of Cetic.br. This online edition, as you all know, marks the 10-year anniversary of this workshop, and we're happy to share this occasion with the 615 participants that have registered for this year's event. So thank you all very much for being with us today. For those of you that are joining us for the very first time today, welcome. And please note the following. All webinars are being recorded and will be made available through our event website. Although the event is being conducted in English, simultaneous translation to Portuguese is also available. You are invited to use the question and answer box for questions. And lastly, please check your emails for guidelines on how to obtain your certificate of attendance. So throughout the past 4 days, we touched upon different topics that address the opportunities and challenges of producing data in current times. On one hand, emerging technologies are changing the landscape of data production and posing new possibilities. But on the other hand, the COVID-19 pandemic has increased the need for timely and quality data to measure the impacts of the crisis in a context where resources are lacking and governments are having to devise new strategies for data production. So yesterday we discussed how public data providers have been adapting to this situation by changing data collection modes, using alternative approaches, changing their sample designs among other contingency strategies. Today, we will debate alternative data sources that can be used to produce relevant and timely data throughout the COVID-19 crisis. So to discuss this subject matter, our webinar today is structured in the following way. We will open with a keynote presentation of 45 minutes, followed by a question and answer session. We will then break for 5 minutes and resume with 2 invited talks of 15 minutes each. All speakers will be invited to address questions from the floor after they have delivered their presentation. So to begin this conversation, I'm pleased to invite our last keynote speaker of our 2020 workshop. Professor Frank Kreuter is Director of the Joint Program in Survey Methodology at the University of Maryland, USA, and Professor of Statistics and Data Science at the Ludwig-Maximilian University of Munich. She is also the founder of the International Program for Survey and Data Science, among other initiatives. Professor Frank, we are honored to have you here today. Thank you very much for your time and for your presence. You have the floor for 45 minutes. Thank you.
Thank you very much for the invitation. And as you can see here on my title slide, it's all over here in Germany, where I'm residing right now. We have fall storms, and so fingers crossed the internet connection will hold. If it doesn't, please be patient, and I will try to accommodate such need. And worst case, we re-record, and then you can watch it later on YouTube. So thank you, Tatiana. I was very excited to see the program for the entire week and the focus of this conference. I think a lot of important topics have been covered. And yesterday, you saw how quickly data collection can change if there's a real need arising, and obviously COVID-19 has elevated that. What I want to do today is zoom out a little bit and talk first about the survey statistics perspective, where the need for change was actually already seen and in process prior to COVID-19 hitting us all, right? So the the government agencies, they have been thinking about how to collect data in a different way and how to make use of alternative data sources for quite a while. And so I'll speak a little bit to that, to those efforts and what was learned in the time that those efforts have been going on. And then I will show you two research examples, one sort of labor market and employment related, but using data sources that also have been used in the COVID-19 pandemic data collection context, and as well as a dedicated survey for COVID-19. And both of them have big privacy issues related to them, which I will address. And I'm sure, if nothing else, that last topic will be one for discussion, but probably the other ones as well. I have been dabbling in the space for a while, and I brought with me here 3 resources that are available for free to you online. The first one is the APOR Task Force report. It also came out in a special issue of Public Opinion Quarterly and can be downloaded for free. It's sort of a report on how to use big data to measure public opinion, but also behavioral data from the perspective of survey methodologists. The middle product that you see here, it's a 2-volume series that was written by a panel conducted by Robert Groves for the National Academy of Science in the United States. And it's a consensus study report, meaning there were scientists from a lot of different disciplines contributing to this. It's a very interesting resource, in particular on the issues of privacy. There are great chapters on that if you want to sort of focus on that a little bit. And obviously it's the US context, so it may or may not apply to you, but even in the US, you know, you wouldn't believe it, but privacy is a topic once in a while. So, and then on the right side is a textbook that I wrote or edited, many more people contributed on big data and social science. It's coming out in its 2nd edition in the fall, and you see on the bottom the link to the free online version of that textbook. And it has some of the conceptual things that I will be talking about, but it also has a lot of just hands-on ways to do it, and shows you code and walks you through sort of practical aspects. So all 3 could be a nice compilation for using alternative data sources for statistics production. So I want to make 3 points here in this first segment on the Survey-Statistician perspective. One is that I do think combined data, and the emphasis is on combined, even though I realized I didn't bold that word, to enhance our measurement, right? So in the past, and yesterday we talked about surveys. They're still a great resource, but the focus here is sort of on thinking a little beyond that and thinking about combined products. But as you will see in these examples, they are particularly good, or maybe they're only good if they are purposefully designed to create good statistics. I mean, there's lots of data all around us, and you can always, you know, we can always make up some data here, right, as we sit, and everyone shouts out some numbers. But the good design is sort of key. And in particular, when we look to alternative data sources, what is essential is understanding the data generating processes behind the data. And the 2 research examples I'll give, I'll point out where it's easy to overlook process flaws, and we need to sharpen our analytic skills in identifying them. There hasn't been, for the last 5 years, I feel like every talk I gave had this picture that Roberto Rigonbon put out as part of this panel that I mentioned before for the National Academies of Science. I love it because it is sort of showing nicely in one slide the 2 different ways you can think about data production. One being more traditional, where you say, it's like, okay, I'm designing an experiment, I'm designing a survey, and maybe I'm designing on purpose a couple of questions to an administrative data form or an administrative process where data is collected. But it's, you know, custom made for my research product, right, or interest. And then in this alternative data source world, there's the notion are data that arise organically. They are byproducts of a process, increasingly a digital process. So, you know, Roberto actually himself is right now doing a research project where he looks at women and men conversation styles in internet setting, or in general, right? I mean, is it true that men interrupt women more? We hear this all the time. Well, if we do all meetings on Zoom, it's very easy to measure that, because you could just have a video recording and then automatically analyze the data, right? Because there's a digital trace, an organic stream of data that comes with regular activity. So that's what this, you know, lower segment here means. And this can be transactional data from credit card records. This can be what he calls aspirational data from social media sources, where we usually aren't quite the people we are at 7 a.m. in the morning, those kind of things, right? So, but they have, you know, an appeal, and then they have challenges associated with it. And let's talk about the appeal first. So many universities and government agencies started to use, in particular, social media data to augment or get a quick read on what's going on in the world, right? You could say it's like, okay, COVID outbreak, we use Twitter data to see where people are coughing more, where this is all heading, and, you know, where we have to send the resources and where the next COVID hotspot is, right? Would that be a resource that works? Actually, I haven't seen this, luckily, because I don't think it would be a good resource in this context. But the University of Michigan has used Twitter to get good reads, more time reads on unemployment patterns in the US. So this was a while ago. You see here the posting in 2015 then said, okay, we stopped this for a while, because for a long time, using the Twitter data and then analyzing the tweets to get alternative estimates for unemployment worked, and then all of a sudden it's not working. And we have seen other attempts like that. People try to use Google search terms to monitor the flu, you know, because if people type into Google search symptoms that they have, you could imagine, oh, maybe this is a good indicator for the flu, or now in the case COVID right now. The problem was that at the time that was done, it really created steam and got their publications in Science. An engineering team at Google, who was not working on this at all, on the flu index, changed the way the Google search string works, right? Remember, there was a time where you just typed in words and then that's what you would find. Now you type in words and you see other words appear and you just click, rather than finishing your sentence or your string of words, right? And that led to an over-representation of words that were related to the flu, and then this index broke, right? So they are very sensitive, because these data collections aren't necessarily designed for what we want. They're organic and serve primarily a different purpose. But anyway, this project still very interesting to look at. Something that we have seen a lot of governments do, and I apologize for my Eurocentric example collection here. I'm sure with a little bit of more effort and homework, I could have had a list of South American countries trying to do that too. Conditioned on the Europe focus, but these were countries that started to do this a couple of years back to like, maybe instead of having job vacancy surveys, we can use job postings from job ads that we find on the web, and web scrape them, process these data, put the data database, and then analyze them. And then we don't have to bother the companies anymore to ask how many open positions do you have, and this and that, what have you. Great endeavor, worked for some countries, didn't work for all. One big problem that there was, and if you are an employer yourself, you might know that, is that it's very tempting, and labor laws require that in some countries, Germany being one of them, that a job is posted before it can be filled. So if you have good candidates send in their resumes, you can't hire them unless there was a job posting, which means that you basically have job postings out there on the web, even if there isn't a job, because should they be a candidate, then there is a posting already ready, and then you can, you see where I'm going, right? So the reflection of what's on the web may or may not be a good reflection of what's underneath there. And it's sometimes difficult to disambiguate different postings. Likewise, maybe there are 5 jobs and only 1 posting, right? So it is still questionable in the word out there whether these kind of alternative data sources can capture the kind of measurement we're trying to get at. Now, the question is, was what we're trying to get at the right question to ask, right? Do we really need to know the exact number of job postings, or do we more need to know sort of what the industries are looking at? And, so come back to that point, but I do think that we get sort of stuck in a way that we used to define statistical concepts, and we try to really always measure that now with different tools, and that may or may not be the best approach. But what we've learned with these attempts of the various agencies, and I only showed you these 2, the job postings and the unemployment claims, that any one of these sources by itself may or may not give us the right picture. But the strength really lies in thinking ahead of time how you could combine information that comes from a couple of different sources. So whether this is a survey data combined with an experiment or with a set of administrative data, which have often a good representation but might come in too late, or they might not have a lot of variables, but they have the relevant rows and subpopulations. But it could, of course, be also a combination of other sources and leaving the survey out. I'm not saying a survey has to be part of the game all the time, but what is useful to think about, triangulation of getting information from different sources or seeing where they can nicely complement each other, either because jointly they cover the population better, or jointly they cover the space better of the things that you want to measure. A friend of mine who works for Umlaut, he has been kind enough to share this visualization of the point I was just trying to make with me, and allows me to use that in presentation. So here you go. This is again Europe-centric, the city of Paris, depicted by Vincent van Gogh. And many of you might have seen this picture before, and we sort of recognize what this is. There's a street cafe in Paris, and people sitting at tables, and it's night. Now, this is our reality, we pretend for a moment, right? And what we're trying to do with these big data or alternative data sources is to get a picture of that reality. Because the data are messy and we don't often know the data generating process, and there can be this double posting or not enough posting of the jobs and what have you, the picture that we get tends to be somewhat blurry, just like the depiction that you see here. And had I not shown the reality 15 seconds ago, you might not recognize that this is the Van Gogh, right? And you might not see now that there is a balcony on that house on the top floor, and if I ask you, are there people standing on that balcony or not, you probably didn't pay attention to that part of the picture when I showed you reality. And so all of a sudden you can't tell, right? Because it isn't as precise enough, and it might be difficult to get to the right piece of information. And on the other hand, if you think about what we used to do with surveys, we were very precise, right? We had small samples, 1,000 people here and there. And then we really measured very well, or hopefully, some government agencies spending a year designing a questionnaire that really measures the concept they are trying to capture, but only for slivers of the population. And depending on the quality of your sample design, that may or may not be what you need to fulfill this picture. And, then hopefully you have good statisticians at hand that can create a data product that's a combination of the two. And if you follow or look into the statistical literature, there's exciting work going on right now using Bayesian statistics and other methods to do exactly that, this combination of different data sources to get a better picture than either one would provide us with by itself. I love this quote here from my friend Roger Peng at Johns Hopkins University from 2 years ago. He said, one way to think about a data analysis is to think about it as a product to be designed. producing a useful product requires careful consideration of who will be using it. And I would say the same is true for data collection, or maybe we should call the whole endeavor, information design, or whatever the discipline will be in the future, because it is not the case that we just collect something that's out there and already ready-made in the way we want, right? Remember, in the traditional way, I said earlier, it's designed survey data, right? We're crafting these questions. That's already a design process, and we design a sample. And the same is true for data that appears as digital traces. It's just that the work happens at a different place, and I'll talk about that in a moment. Let me give you an example, again, going back to the work that Roberto Rigombon does. He's from Venezuela, actually, so maybe some of you have met him in some context, speaking at venues in South America. This early idea here, I think, works so well to get the point across how we as survey statisticians have to loosen up a bit, and have to rethink what it really is that we're trying to measure. What are you looking at here? You're looking at a time series, an aggregated inflation series for the United States. Similar graphs now exist for 150 countries. And it's changed over time. The orange line, in case this shows up on your computer in two colors, but the more smooth looking line is the official inflation index as it's produced by the Bureau of Statistics in the United States. And the blue line is the alternative index created by the Billion Prize Project running out of MIT. What was the, I think, brilliant idea of that group? They said, if we, maybe we can capture the change in prices by web scraping online prices and, capturing changes in prices as they appear from day to day. And by doing so, we could be much faster than the traditional statistical agencies that samples products and then scans them in, or samples, stores and goes in and, scans the prices and what have you. The economists on this call, might shudder and say, it's like, well, wait a second. At least prior to COVID, the online market of goods was very different than the offline market. And it is not the whole basket of goods that we have in these online prices. How could this possibly give us a good inflation index? Well, there's one big assumption in here, and that is that you say the change in price would be the same in the online and the offline goods, right? If you think that the development over time for the online market is similar as the one for the offline market, then this biased sample of online goods might give you a very good representation of the changes over time. And this is, I'll come back to this example when I talk about the COVID study. I think if you make, in a context where you need data quickly and where you're interested in changes over time, a reasonable claim that the people that you're not observing, the people from whom you don't have data, over time develop in the same way as the ones that you do have data from, then maybe you can use alternative ways to get at the data or to recruit people and have you, right? So really, it is knowing your own inferential goal that makes this possible and should be driving your design decision. All right, so let me show you two examples where sort of new measurement devices have been employed and what precautionary tales we learned from it and how people went about solving some of the problems. So the first example here is from economic research. The big question behind the study I'm talking is about effects of long-term unemployment. What I do want to point out are ways to sort of have new ways of measuring without running into problems on not knowing what coverage problems you have, which parts of the population you don't have, and things like that. So I mentioned the effect of unemployment is what was driving this research question. The sociologists in the room might have heard of this Austrian study Marienthal. The name of the town is fake, but it is an actual study that happened, was done by Paul Lazarsfeld and Maria Yehuda in the 1930s. They were observing an entire town after a massive layoff, right? So they would, send researchers and themselves out and stand at street corners and measure how many people talk to each other, how long it takes them to walk over the bridge, when they eat lunch, and looking at the daily structure and the activity. And what they found is that this long-term unemployment totally disintegrates the daily activity structure of the people, and that people, there's this famous quote, all of a sudden it was noon, and this kind of disintegration of the daily structure makes it then difficult to get back into labor force. And so, this kind of observation is hard to do at scale, right? We have been used to doing surveys, sending interviewers out and what have you, but you cannot have an interviewer just live with you day by day over the course of 6 months and monitor everything you do and count your steps and, see how many friends you contact and whatnot. But, lo and behold, today we do have actually a little AI-driven devices, if you will, some computers that do that, right? This is their job. Most smartphones that we have with us, at least in large portions of the world, have integrated step counts. They do measure our activity level. The smartphones do capture whom we call. We have an address book on our smartphone, and we can see how many people in our network are we interacting with and how often, right? So this data is captured on an ongoing basis, and maybe it's time to sort of rethink how we do data collection and tap into that basis, right? And obviously smartphone data collection and counts have been one of the things, at least here in Germany, I followed this closely, discussed in the COVID context, because people thought, oh, well, maybe we can, measure vital signs of folks and see what they do and, predict whether they are about to get sick or what have you. Again, trying to find hotspots. We did some pilot studies on seeing what you can learn from these smartphone data. And this one you see here is actually the uses of apps on the smartphone. So the opening and closing of an app. You see here 24 hours of 10 people each. The first group, employed people, second group, part-time employed, the last group, job seekers. And over the course of the day, every app opening and closing is depicted with a little bar. The colors of the bars are different types of apps, entertainment, job-related apps, and what have you. And this team of students looked if the employment type is related to what we do on our phones. Kind of an interesting question, in particular in telecommuting and teleworking times. As an employer, I have to say, I was a little shocked to see the lower of the two graphs. The fact that the use of entertainment apps over the course of the day is pretty similar among the part-time employed and job seekers to the full-time employed. And, I certainly would have expected a larger use of emails, apps among the full-time employed. And we see that in the upper graph, but the results from the lower graph are a little disconcerting, right? So this was a fun study for us, a fun set of data to us to play with, but to really make this a good data product, this volunteer sample of 1,500 people that I just showed you that provided data for a year probably wouldn't cut it, because we, working with official statistics, are concerned that we are not capturing the entire population. And so what we did a couple of years back in Germany was that we sampled from a large existing household panel study, which itself had been linked to administrative data, the uninsurance claims, employment insurance claims of everyone who is sort of in the labor force or dependently employed in the labor force in Germany, so that we have a good read on who it is and who isn't participating in the panel survey itself. We recruited them to install an app on their phone that allows us to measure all these activities, what they're doing on their phones throughout the course of 6 months. And so there are coverage problems related to that, but the trick is, or was in our case, that we always try to have enough information about the population that's not covered to be able to then readjust the data to do so. And if you use smartphones as your primary data source, for example, to now measure the vital signs in the COVID context, you first have to adjust for the undercoverage of people who don't have a smartphone, which we asked in the panel study, so we were able to do that. Then we needed to adjust for the Android usership because this kind of data collection is only possible on Android devices. iPhones are a little bit more closed off and everyone else is kind of a small population. Then we had our sample itself. We know how to adjust for that. And then of course we have non-participation error that needs to be adjusted for, just like in any survey. Briefly, so that you get an idea of coverage issues with this particular study, at least in Germany, we did, not surprisingly, find the higher educated one more likely to have smartphones, the immigrants less likely to have them, those living in the East less likely to have them, and the like. But remember, with careful design, you can then adjust for it. So I would caution, I mean, what we saw here in the COVID context, our institute that sort of coordinating all the COVID-related data collection, they ask for volunteer donations of vital signs data from smartphone apps and Fitbits and the like. They have no idea what that population is. They don't know, are these the active people? Are these the old people? Are these the young? So they were lacking this kind of context that we were able to achieve. So, here's a sneak peek of the data just so that you can see. Back to the unemployment question, is there a loss of activities and daily rhythm among the employed and unemployed? And on the right side, you see that the disintegration that we saw in the 30s, we don't see in these data, at least not among the entire population. Of late, we looked at differences between males and females, and stay tuned. There are some pretty interesting results coming up, but I won't show them in this presentation. So very briefly on the error sources, like cautionary tales, as I promised, and I'll move on to the COVID survey. We have issues when we collect with different devices. There's might not be enrich. There might be manufacturer settings that you have to override. It might be problems with loading an app. So all of these are fine and can be overcome as long as they are not systematic biasing your sample. And we looked at these device-related errors by the type of smartphone, by the type of operating systems. And, for some, you do see differences. The older operating systems, they're more prone to errors and gaps. So you can easily see how that's related to the socioeconomic status of your population. What was fun to see when you collect data via a smartphone and alternative devices is that geolocation, very important in the COVID context, right? People try to pinpoint people where they are. But turns out we learned there are software out there that fakes a geolocation. We had some respondents that within 45 minutes, went from Hamburg to, down here in the middle of the ocean, but far away, which is just not possible, right? I mean, there's no flight that gets you there that fast. This is a piece of software that people can have on their phone that scrambles the geolocation that your phone provides, right? So, didn't happen that often in our sample, but you could imagine if this becomes a worldwide effort, as some of these data collections now are in the COVID context, this can be a problem. We had other issues that we saw here. The app itself, that we were able to relate to these fake latitude and longitude measures was called joystick, and eventually tipped us off, and we looked into it and saw that problem. Another problem that we saw is that males and females are very different in how they wear their phone and device. Some have it with them, others don't. And because females, my hypothesis, tend to wear purses more, they might to put down their purse and then walk around, whereas males have it in their pockets. And so you have by default a different step count that is even tracked by the phone, or the phone even be turned on, or off differently depending on the socioeconomic and living context that we have. So the elderly tend to turn them off more often, not keep them around, not look at it. And I can certainly attest that for my parents. Sometimes I try to reach them and I was like, isn't your phone on? What's going on there? So, that at least some qualitative assurance that this is not totally wacky. One thing that I think is particularly important as you do data collection in developing countries is the use of phones and other devices by multiple people. So we're trying to do household surveys, we're trying to do people surveys, we're trying to learn something about an individual. And then it turns out that they're sharing the device with the kid, or, kid is nervous and then the mom gives the tablet over to the kid, and then, YouTube videos are watched during work hours. Well, turns out it wasn't the mom watching the YouTube videos, and I shouldn't make an example, so gender stereotype, but you get the idea, right? That not everything that we capture here automatically will be give us the same read what we want, what we would design for if we really could design that kind of data collection. All right, so let me move to the second example, which is more traditional in the sense that it is a survey where the data is collected, not this passive measurement of a smartphone. But we used a public-private partnership again to tap into a new way and a different, I guess an alternative sampling frame that we haven't used in the past. The motivation for this was that a lot of people approached Facebook because of its wide reach to do a global survey, a syndromic survey, where every day there would be a read on symptoms that people show, so that you can early detect new hotspots and patterns, first in the US, but then eventually globally. The WHO was part of this endeavor, and many others that contributed to the questionnaire. The idea was, or the suggestion that Facebook eventually made to accommodate all these needs was to have, when people access their Facebook on their phone or on the computer, at the top, see an invitation to the survey. Then they get moved over to, in our case, a Qualtrics platform. They fill out the survey, and then we analyze the data and share the data back to Facebook, but only in an aggregated way. So the individual survey responses never touch the Facebook data, it's completely separated, but the Facebook platform is used as a vehicle, A, for sampling, and B, for creating weights for the survey that we created here. The instrument itself surveys health symptoms, contact behavior with others, some questions about mental health and economic insecurity, and some brief demographic characteristics. It's very short. Otherwise, we wouldn't be able to capture by now over 20 million responses globally and about 10 million in the US. So 30 million total since this survey had been running. Again, its beauty is the development over time. Remember that example I gave you earlier from Roberto Rigon-Bon. We want to see changes over time, right? We know not everyone is on Facebook. We know Facebook is not a sampling frame for the entire population, but we will be able to see and track changes over time and interpret them. For example, right now, we are looking at differences in mask use over time and how that changed in countries. Here you see the week 17 to week 40 in mask use in different countries on the right side. And if you go to the SOTA website, the Social Data Science Center website at Maryland, you can play around with these data a bit more. The data itself is available either in the aggregated form via the CMU, our partners for the US, or the Maryland side, although it was down yesterday. I hope it's back up. And then the non-aggregated data can be accessed by everybody who writes to dataforgood@facebook.com with the proposal and then a data use agreement with the universities to access the APIs. That can be nicely combined with other data that Facebook puts out. They are using their platform to give overall maps of movement, of social connectedness and the like. So I'll encourage you to check out that platform. Can't talk about Facebook and data collection without mentioning privacy, and I will do so in the last 2 minutes that we have. We can quickly face high privacy risks, and if we don't look at the appropriate flow of information, we certainly will upset people. And what 10 seconds tail, Netflix, some of you might have heard about the Netflix challenge. They gave out $1 million for a contest for people to be good in predicting what kind of movies people want to watch, right? You saw like these 5 movies, what will the 6th movie be that you watch, right? They put all their movie watching data out there, and then have people run AI models, predicting the next choice. That was fine, except that some people also post the movies they watched and what they watched when they watched them on other sites like Facebook or the International Movie Database or what have you. Then linking these 2 data sets together, people were able to identify, oh, these 5 movies were watched by Tatiana in April of 2015. And look, here are all the other movies that she didn't tell us about she watched, but that's visible in the Netflix data, right? And so a huge privacy risk. Even so, the microdata that Netflix released did not have any PII, any privacy indicators. So those kind of things you have to have in mind. We easily ask people for consent. GDPR and the new Brazilian data protection laws, they're very heavy relying on consent. People, feel differently depending on what's done with the data, whether, it's just someone has access to your data. Maybe we don't care as much. We certainly care a little more if inference is made about us. And we care a lot more if an action might be taken against us, right? And depending on your country context, you risk the center of this, what's at the heart. What I saw in my own research, and this is the last couple of slides and I'll be done, that we can easily shape people's consent, right? These were experiments we did where the only thing we changed in the consent request was telling people that, the data they would provide us in addition by allowing a linkage between survey data and administrative data would be much more valuable or much less valuable. That was the experimental condition. And the other condition that we did was to ask us at the beginning of a survey and ask it at the end, whether they would be willing to link data to an administrative source. These tiny changes, the placement and the wording, led to a 10 percentage points different. You see that here. In the front ask, 90% agreed. In the back ask, 80% agreed. This is a huge difference for survey methodologists, and just shows that this consent might not be as of a stable attitude as we think it is. And so just because people say, yeah, that's okay, and sure, it doesn't necessarily mean that they are comfortable with it, what we end up doing with the data. So in closing, great potential to ask some new questions, to get data faster, to make use of these alternative resources. There are some inferential issues inevitably because the coverage of these new data sources isn't always perfect. We have to very closely look at data quality and the process that generates the data, as well as privacy concerns that people might have. Not everything that looks like it's not a PII is really not a PII, depending on a personal identifiable information, depending to what you link it to. And Tatiana mentioned this at the beginning. I do encourage everyone here to try out doing this. And if you are in the need for further training, the international program that Tatiana mentioned is available not just as a master program, but also for individual course taking and certificates. So be in touch in case that is of interest to you. Thank you very much.
Thank you very much, Frauke, for this fantastic presentation. We have already received a few questions from the floor. We're still opening for questions and encourage all participants to share their thoughts, views, comments. But at this time, I would like to mention one question that we received from Luciana. She wants to know, Professor Frauke, what is your opinion on considering digital data as a public good because of its value in supplementing scarce national statistics and informing interventions, including in emergency situations. She wants to know, how can big companies be engaged in this, especially mobile network operators? And perhaps I could add a question, if you could elaborate on the challenges of establishing partnerships, which are so crucial for obtaining and treating this kind of data.
Yes, so maybe I start with the partnerships, right? The big challenge is to make it clear to every partner what the benefit is they have, and sort of think of what risks they might face and try to address them, right? These risks are real, and there's no way in pretending they aren't. And I think that oftentimes we see people are willing to collaborate, but institutional regulations or what have you might just prevent them from doing so, right? And then the next step comes is like being creative enough to try to solve these problems, right? So in the COVID example with the partnership with Facebook, it was crucial that they had a university that could collect these survey data, because otherwise they would not be allowed to share the results, the microdata, right? Because the privacy protection now disallows Facebook to share data in that way. And so without that kind of partnership and moving people, like recruiting on the platform, but then moving it over to the universities for the collection, that was sort of the key stepping stone in solving that problem. On the first one, considering the digital trace data as a public good, here in your question, I wish I had shown you results from one more study. We actually did ask people how they feel about sharing their data for a public good purpose in 2019, and we happened to ask about their willingness to share it to combat a virus. and it was funny. We didn't anticipate, obviously, COVID. That was, pure coincidence. We tried to think of something that people might understand why, data collect on the phone and vital signs would be worthwhile collecting. We saw a lot of resistance compared to sharing your geolocation to improve traffic pattern predictions and the like. So that has changed. We replicated that study in 2020, and we saw that people are now much more willing to share these data. But I think it is important, while I do think they are a public good of sorts and should be used, we do need to respect the context in which people generate these data, right? Helen Nissenbaum created this term, contextual integrity. We have to stay within this integrity, of, well, I provided my data for this purpose, and surely you wouldn't use it for something else. The favorite example she gave to me once was, imagine you enter a bar and the bouncer at the door looks at your driver's license and sees that you're old enough to enter the bar. You will not want to see that bouncer appearing at your house because he also saw your address, right? That would be totally out of line, because in this context, while he received that piece of information, there's sort of a social norm that he wouldn't use it for this different purpose, right? And so we have to respect people's perception on what purposes something should be used for, or some data should be used for, and that that's often not easily answerable. I mean, so just saying globally it's a public good, I think, can be a little dangerous.
Thank you very much. We have another question coming in from Fabio, and he wants to know, considering the underlying phenomenon for designing data collection and analyzing data, he would like you to comment on the importance of the diversity of the team that designs or analyzes the data or the surveys, or so he specifically mentions gender, socioeconomic aspects, the worldviews. He would like you to comment on the importance of the diversity of the team that is actually dealing with this data.
Yes, so the employment study around the IRB SMART project that I mentioned, right, where we use the phone data, the admin data, the survey data, we tried to do that with a rather homogeneous team of, your usual combo of sociologists and economists. I wouldn't say we failed, but it was pretty tough, you know. I mean, it was fine on the data collection side, but on the analysis side, we were really pushed to our limits, right? We had to scramble to, you know, quickly tool up and learn how to use databases, how to use software that can handle this volume of data better. And that was actually true too in the COVID survey with Facebook, that while we are experts in designing surveys, we are surely not experts in creating an API to share out millions of records every day. And so, yes, we in both of these examples, and also when I look at data science teams, I have yet to meet someone who can do this all in one person, right? If you're lucky, I think we can all empower ourselves to know enough to speak the language sufficiently of these other disciplines in computer science or AI and machine learning, so that we can communicate and say, hey, this is what I need, or that you even know that there could be a solution out there in this direction. And that's sort of what I'm trying to do with the education programs that I designed, that I, you know, empower people enough to be part of the conversation. But to solve these issues, it will always be an interdisciplinary team that has to work together. It's simply too hard to do this, and not one person can have all the skills or all the time to do this all. Yeah.
Yes, this is still a challenge indeed, but thank you, Fabio, for this important point. Eduardo wants to know, in your opinion, why do we not generate efforts among the scientific communities worldwide to elaborate and maintain open standards that use algorithms and computer centers with internationally integrated and standardized databases? Or perhaps how could we improve these efforts?
Yeah, that's such a timely question. I'm part of another National Academy of Science panel in the US, where they're trying to do that for the US, you know, to decide on standards on how data production should be, you know, documented, available, and then, you know, next step would be to do that not just for the data collection, but also for the algorithms that are used to analyze the data and what have you. Countries that don't have legacy systems might be a little bit better off, right? They can from the get-go, you know, decide this is what we're going to record, and this is the digital day we do it, and we all look at Estonia and are astonished how well they do this, right? In countries with, you know, with more historic or pretty decentralized systems, it's very hard to agree on what those standards should be like. But it's also one big difficulty I see also is that it's not always clear what the data will be used for afterwards. And so what you document about the data and what you really store and in which format, you know, it might not be clear. And then you might need to go back anyway to the raw data, right? And so a lot of work, in particular with these new data sources where you don't design the data collection up front, then it's a little easier to have a standard, right? You have your metadata for your survey and all of that. But if you capture the tweets afterwards, you know, and you generate algorithmically some summary statistics on or emotions or sentiments or what have you, what is it that you protocol? You know, what should go in there? What of the algorithms do you need? Right now, we don't even know yet how we would capture this well, you know, and what to capture from it. We are, I'm part of a group that wrote a proposal on the German national data infrastructure to solve that, but I'm not aware of good systems. If you are, let me know, and they will shout them out in the world that everyone joins your effort. But there's just a lot of legwork, I think, still to be done to figure out how to do this flexibly enough so that it's then also useful for the next data use, if you will.
Thank you. Eduardo Francisco, different Eduardo, he wants to know more about data protection regulations, and he's concerned about the risks in using geolocation data from cell phones, although they could be very relevant. So he would like you to elaborate a little more on this topic, on the right to privacy. And I think that I would add a question regarding, you were mentioning metadata and how to disclose what has been what the data has been used for. So I was wondering, how has this sort of data results been received by the general public and even by government in terms of trust? And how can we explain these complex methodologies and have these data being used for official statistics? Or how do we open and share this data among the public, given its complexity in its treatment and in its analysis, and even in terms of privacy concerns?
Do we have another hour? So on the sharing side, you know, let's start with the geolocation. So geolocation is a tough one, right? I mean, this is so easily identifiable, where you live, what you do, whom you visit, and then you can triangulate that with other pieces of information, and then you know who that person is. But you could imagine that you capture derivatives of a geolocation, you know, like a larger, I mean, there are privacy preserving techniques now to work with geolocation data, if you will. I guess that's the shout out I should do to that community, where you could say, it's like, okay, I just measure the distance between that and some location, you know, let's say a childcare center or a hospital, right? And all I capture from the phone is that distance, right? So for example, when in the smartphone study that we did, we captured the entire phone book, if you will, but we didn't, I mean, we captured the phone numbers, but in a hashed way. And then we just counted how many times that hashed phone number was called, right? Or we pinged the name against the name and the gender classifier, and then we only captured that result rather than the actual name, right? So there's often an additional step you can do if you already know how you want to analyze the data. And that I would encourage you to think about. And then maybe you don't need to save the geolocation, right? You can just leave that alone to begin with, if you just want to. And so the more, and this is the direction this field is going, that they're looking at what could be done on the phone locally, and then save the derived data of that, right? So this kind of local differential privacy is what, you know, the keywords that you can look up for that is one technique. And since I have 0 seconds left to answer your additional question, Tatiana, let me just say, I think it is useful to make these data available broadly to the scientific community. I'm a person of two hearts when it comes to open data, because I do think we underestimate the risk that is out there with putting all the data out in the open. They can be linked together. I think large cloud-based computing environments like we tried to build with the Coleridge initiative, where you still know who is analyzing the data and what projects are done with it, could be a better solution. But as I said, that would be a whole nother talk. And so we'll save that for 2021 when I come in person.
Thank you very much, Professor Frauke. It was really a pleasure to listen to your presentation. And I truly hope that you are able to come back in person, hopefully next year. Thank you so much for accepting our invitation. Unfortunately, we are out of time. We will now break for 5 minutes, for a 5-minute comfort break, and resume shortly with our second invited talk. Thank you very much indeed.
Thank you for having me.
We are back for our round of presentations. I also would like to thank Professor Frog for this wonderful presentation. And as we've seen, alternative data sources, and in this context, we can mention or name many data sources such as big data, administrative data sources, citizens-generated data, tracking devices, data, mobile phone data. All these sources became essential for statistical data production. And I would say that most countries are really facing increasing pressure for the production of more disaggregated data, timely data, with a very, in most of time, scarce resources, particularly in the context of the pandemic that we have seen in the first presentation. We will now have two invited speakers that will bring important examples of the use of alternative data sources, one focusing in the monitoring of public policies to evaluate the response to COVID-19, and a second one on inclusive and empowering digital transformation of cities. These presentations will be also followed by a question and answer session. So please be encouraged to take note of your questions throughout the presentation and share them with us through the Q&A box. To begin the session, I'd like to give the floor to Professor Lorena Barberia from the Department of Political Science at the University of São Paulo. Professor Lorena is the scientific coordinator of the Solitary Research Network, Public Policy and Society. This is a research project that seeks to improve the standards, also to calibrate the focus and improve the quality of the federal, state, and municipal level governments policies that seek to respond to the COVID-19 crisis. Professor Lorena, thank you very much for being with us today, and congratulations for this amazing research project that is really very important to Brazil. Professor Lorena, you have the floor for 15 minutes, please.
Hi, I think okay, I can start my video. Here we go. Hello. Good morning to everyone. And I want to start by thanking NIC for the support, not only of organizing a methodology workshop on surveys and being in the 10th year of such an initiative, which is very important, but also NIC is one of the institutions that has, from the outset and from the founding of the Solidarity Research Network, has been an important supporter of our work. So I want to thank also NIC for this support. It was really wonderful. I really enjoyed the keynote today, and I learned a lot. And what I'm going to be speaking about now, and I'm going to be sharing my screen. I hope everyone can see my screen. What I'm going to be trying to talk about is actually showing an application related to COVID-19 in Brazil and showing some of what we're going to do. And so I'm going to, some of what we've tried to do in order to generate our own data and to use this data to evaluate the response of the federal, state, and municipal level to COVID in Brazil. And I'm going to show there's parts of this project have to do with generating your own data. Part of it has to do with using artificial intelligence and machine learning to infer and to make comparisons. And part of it also, I think, of what my presentation, I hope I'm going to show, is a little bit of some of the challenges in doing this type of research on the ground, some of the challenges that are posed. So very briefly, and I apologize, I'm going to try to go quickly through the slides. But basically, what I'm going to try to talk about first is I'm going to show an indicator that we've developed to measure the stringency of social distancing policies. Then I'm going to show how we use that indicator to evaluate adherence or compliance with social distancing. and what are some of the implications in terms of what we've learned so far in the first 6 months of the pandemic. And then I'm going to also show, when we look at and use survey data, how the survey data and the insights we have from more granular data helps us to and complements what we know from more aggregate data that we have using mobility data. Okay, so basically in the project that I coordinate, we're very interested in we're mapping and monitoring public policies at the federal, state, and municipal level. We are also interested and we're particularly trying to grapple with and monitor individuals and families, especially thinking about vulnerable populations. And why vulnerable populations? Because we depart from the premise that public policy should be made and designed and implemented to protect society as a whole, including the most vulnerable. So we're very interested in examining and understanding the response of and how public policies affect these communities. And then we're also interested in a part of what we've done a lot of work on in our group is looking at and calling attention to the problems that we have with official data and why they make evaluations in this moment really difficult. One of the parts of our project, we're developing what we're calling the COVID-19 Government Response Tracker for the Brazilian Federation. It's inspired by the Oxford COVID-19 Government Response Tracker, which we're part of that initiative, and the indicators that we code, we feed into the Oxford tracker at the subnational level. But we've also sought to further deepen and further develop the indicators, especially thinking about adapting the indicators to the context of federalism and some of the specificities of the Brazilian case. So thinking about, for example, with education, where we have federal and state governments that overlap in their responsibilities and in the type of education services that they deliver. So we need to think about how that aligns and how that matters for the policies that we're analyzing and evaluating. So in the tracker that we're developing, we're looking at the non-pharmaceutical interventions. What do we mean by that? We think about what we mean is all of the different public policy interventions that are being implemented to increase the physical distance between people and lower the speed of transmission of the airborne virus that we're currently trying to avoid the further spread of in Brazil. We're also thinking about and we're trying to track public health initiatives, and that ranges from testing to treatment to intensive care, and the economic policies. And part of the reason why we chose to follow the approach of the Blattman School of the Oxford Government Response Tracker is that we think that this goes beyond a specific, this disease and the challenges it poses, it goes beyond just treating or thinking about this as a health problem. And we think we need to also think about how different public policies feed into each other and affect each other. And so having this integral approach is really important in our research. What I'm going to try to show and underscore in my comments is that we also need to think about, when we're trying to think about how we generate data and alternative sources of data, is that we're seeking to develop indicators that are substantively more informative. And so here's a slide just trying to call attention that on paper, if we look at the interventions around social distancing measures, the school closures, commerce closures, the fact that if construction services were closed or not, public events, if they were limited, if we think about stay-at-home orders and mask mandates and restrictions on public transportation, on face value, São Paulo and New York look substantively very similar. And so it's very important, and as a political scientist and someone who studies a lot policy, it's really important to think that we need to go back, and we need to go back to the actual policies themselves and coding them more granularly to capture the level of stringency and how it varies across these two states, and to see if the level of stringency in the policies in New York is equivalent to Sao Paulo. So how are we doing that? In the group, we look at decrees, laws, and ordinances that are restricted to specific level of government. So we code that at the municipal, state, and federal level. We look at recommendations we're really clear about making a difference between whether you're saying it would be nice if you guys use masks versus if you mandate a mask requirement and have enforcement, including fines associated with that mandate. We also look at the sectoral scope and the geographic coverage of those policies. So these indicators that we've developed, and here's a summary of the indicators and the scoring. The idea is to try to go beyond an intervention of identifying a date of when a law was introduced or a mandate was introduced, and really talk about the fact that measure first has different levels of stringencies, and that level of stringency, it can matter because it pertains to the entire locality, to specific parts or specific regions, to specific groups, and also that it changes over time and it's a dynamic policy. So that the fact that when it was introduced doesn't mean that it stays in place at the same way. And over time, we see governments are changing these measures and adapting them. So this is a summary of the index that we've developed for those 7 indicators. And it's mapping what we see as the level of stringency that is in place in the Brazilian Federation at the state level on this figure. And we're looking at that, and the way you should read this graph is when the state is a darker color, that's a state that has a higher level of stringency. And when the figure is lighter, we're looking at a state that has a more lax or a less stringent level of stringency in that specific month. And this is the average over a specific month. So this shows that there's a huge variation across time. And it helps to also underscore another part of the research that we've been trying to underscore in our project, that the fact that what we've seen with COVID, and one of the difficulties in analyzing the response to COVID at the local and state and federal level in Brazil, is that the response is fragmented and it's not coordinated and it varies across the country. And that creates a lot of issues for adhering to those mandates, because if we looked at a more granular level within each state, just like I'm showing you this map that shows variation across states, we would find that same variation within a state across municipalities, especially as since June, many states are introducing flexibilization plans or loosening social distancing with plans that mandate that now who is making the policies is municipal governments, and municipal governments have more discretion for deciding the level of social distancing that should be in effect within their specific territory. Okay, so what we're interested in wanting to look at when we look at this is, does higher stringency have an impact? Do people comply when a government mandates increased social distancing, or is this something that is really social distancing is not affected by policy? And so the way we do that, and the way that researchers have been trying to study this, is there's been a lot of interest in looking at cell phone mobility data to try to test if there's an impact, and we can see a relationship between the impact or the introduction of measures and how society has responded. We can also look at survey data, and we can look at other types of creative data, like a little bit like what was being hinted at, is we can look at things like Facebook or other types of social media and see interactions and see what people are talking about. And also using that type of mapping, we can see what is the level of compliance with social distancing. Because ultimately what we want to know and what we're trying to understand is, how does the fact that governments are implementing policies to increase physical distance between people and are guiding people to wear masks, wash their hands, not to agglomerate or not to come together in condensed closed spaces. And if those people suspect that they've tested positive or they've come into contact with someone that is positive, that they self-isolate for 10 days while they're possibly infectious and can transmit to other people. So what we're interested in is capturing what part of those behaviors do people comply with, and what part of those behaviors is there difficulty, or is there less effectiveness than what we would hope to those policies. So here is just really quickly the level of how many cell phones are at home during the day in the same location where they were during the evening. And here what we're looking at is the percentage of people who are staying at home. When the map is darker in that state, that there's more people staying at home. So what we see is in the response to COVID, and similar to what I was showing in the map at the beginning, as the policies begin to be introduced, there's an equivalent response and equivalent change in the percentage of people who are staying at home. If we look at this type of measure of looking at cellular data. The important thing to capture here, and this is data that we're very grateful to InLoco to provide to us for research purposes and for us to look at this data. But what are the problems, or what are some of the issues with this data? First of all, this is data that it's aggregate data, it's not individual behavior. So we're aggregating data about home permanence, and we're hoping that this data means that these people are staying at home, wearing masks if they go outside, washing their hands, isolating if they've come into contact with people who tested positive. But we don't really have a way of inferring all of those things just from knowing that someone is at home with their cell phone. So part of the work we're doing in the group is we're interested in looking at this type of data and thinking about alternative measures that we can use with cellular data that give us more insights into this type of other parts of behavior that might be important. But what I do want to show is to show a little bit of, to pose the difficulty is, here we're looking, and I apologize that this slide is in Portuguese, but we're looking at the mobility in using Google mobility data of the mobility in New York and Sao Paulo, which I started showing initially, and showing that it looks very similar, even though I could tell you, and I didn't show you the slides, but substantively, New York and Sao Paulo adopted very different social distancing policies. Yet if we look at the mobility, the two cases look very similar. So it poses a question, is this data really as helpful, and should we use it to make inferences about what's happening on the ground, given that we don't see as much variation, given the differences in social distancing in both contexts? We should see that mobility in New York is much lower than Sao Paulo. And from this, at least from this measure, the differences don't appear to be as strikingly different in both cases. But in our research, we have shown actually that when we look across states in Brazil, even though Brazil adopted moderate level of policies, we definitely see that there's some specific policies that made a difference in having more people at home. So if we look at, this is looking at the long-term effect. So how many more people stayed at home because of the introduction of a social distance policy. And what we see is everything that's to the right of the dotted line is something that increased adherence or compliance with social distancing, and everything to the left is what reduced. And so what the story here is saying is that the closing of schools, the closing of commerce, the closing of, or the prohibition of public gatherings and stay-at-home orders, those contributed to having greater, in states that had more stringent measures on those indicators, we have a greater number of households that stayed home. But in contrast, the mask mandates reduced the number of people staying at home, which intuitively makes sense with what we know, because the mask mandates were introduced in a moment when many states were loosening social distancing restrictions. So this shows that there is a relationship, and what we're looking at here is the mobility data. So the dependent variable is the level of how many households are staying at home, and the explanatory variables are the policy indicators. And we're asking, does policy make a difference for compliance, which is what we want to explain? And the answer is yes. There's statistical evidence showing that across Brazil, even in a moderate setting with moderate policies matter for compliance with social distancing. With survey data, and this is just jumping really quickly, I'm not going to talk as much because I don't want to go over time, but with survey data, we see the same thing. As part of the Oxford collaboration, there was a survey conducted by phone. In 8 capital cities, we have the social distancing policies in those cities, and we compare those cities. And we also look at, and we try to think about specific vulnerable groups in those cities, and thinking about, what about them? Do these policies also guarantee greater compliance? And the interesting thing about this study is that we have the policies in place at the state and the municipal level, which were policies closing schools, closing commerce, or mandating some kind of closures. And at the same time that we have those policies in place, we also had federal government policies that were doing the opposite, right? So federal government policies were providing emergency cash transfers, mandating people to go outside. And the interesting thing that we show, we do machine learning where we track COVID infection risk symptoms. We show that actually the policies that were in place by the cities aided and made a larger difference in explaining the mobility of vulnerable populations than the emergency cash transfer. So if we consider the fact that the emergency cash transfer, you had to go to a bank or you had to go to get goods in supermarkets, and we contrast those movements with the policies that were in place at the municipal level, we see that in cities that there was greater level of stringency in policies, even though the federal government program was mandating that you need to go outside, people complied and stayed at home. So I think this is how I want to end, but I think what we want to underscore is we need to be creative about the data we use. We need to test for robustness and think about alternative ways of also gathering complementary data and mixing that data to try to further test the robustness of our findings. Thank you very much.
Thank you very much, Professor Lorena, for this very interesting presentation. Sorry, my video was off. This is really a very interesting and amazing research project, and it is indeed an excellent example of how to use those alternative data source, as you mentioned. In the interest of time, I will now invite our next speaker, Professor João Porto de Albuquerque, who is the director of the Institute of Global Sustainable Development at the University of Warwick in the UK. And Professor João is also a Turing Fellow at the Alan Turing Institute. Professor João is developing amazing, innovative, transdisciplinary research methods to improve the understanding of social, technical, urban environments with a view to produce a transformation to sustainable development. Professor João, it is a great pleasure to have you here with us today. Please, you have the floor for 15 minutes.
Many thanks, Alexandre. It's a big pleasure to be here. So hello, everyone. Good afternoon for me. Good morning for many of you. It's great to be here, and I was so pleased to be in this. It's this great session, and to hear Frauke and Lorena speaking was really inspiring, I think. And I think, you know, in this presentation, what I would like to do is really to ask this question. You know, thinking about the great work that NIC.br in this workshop on survey methodology is doing and asking about the future of AI and data production, I really was like connecting this to one of my main research interests. So I come from a background in computer science, and having been active in geography now, I'm really looking into how these new sources of data and the new survey methodologies that we are discussing here, how they are transforming cities. And then in this context, really asking the question of, are we heading towards an inclusive and empowering way of transforming digitally cities? Um, I'll have a look at this question with you today, and in the next about 15 minutes. The idea is that we made some thoughts. My answers to this, to preempt a little bit, is that I'm not fully sure that we are really heading towards inclusive and empowering digital transformation, and I think this is an important question to some of the methods we are discussing here that I wanted to share with you. And I would like to do this really from the point of view of the context we are talking. And many of you here are based in Brazil or in Latin America, and know this context. And I think it's really an important context to think about. When we think about new sources of data, as we've been talking about today, the big data, the citizen-generated data, sensors, and so on, one key challenge I think that we have to bear in mind are our strong and stark spatial inequalities in cities. And I think this is, this picture, this photo that I'm posing here is perhaps known for some of you. It's in São Paulo, not very far away from NIC, from the headquarters of NIC and Cetic, I think. As in the Morumbi neighborhood and the Paraisópolis neighborhood in São Paulo, which are side by side here, showing a very, very strong contrast of two realities, very different from each other, but very close spatially. And I think, one question that I think is important, and that these inequalities, and this photo kind of like acting as a symbol for this context, bring to us when we're talking about this survey methodologies and the use of new sources of data is really how are them reflected in the data sources that we are using. And interestingly here, I'll bring an example, which I did with Javier Macaya, also a researcher of Cetic and NIC.br here, looking at how actually some of the, concentrations. So some of you know this is the map of the city of São Paulo. And it's a very strongly spatially segregated city. And this is the concentration of monthly income. Actually, I could show you the map of the education levels, which will be very similar to this one. I could show you a map of health indicators, will be very similar to this one as well. And actually, this is the characteristics of São Paulo, of a very spatially segregated city. And actually, we had a look at this research with Javiera, or at a particular example of let's say a data which is a byproduct of activity, which is the use of digital channels for specifically requesting public services in the 113 service. And you'll not be surprised to see that actually the maps looks very similar again. So again, if you're looking at this data, the data generated through digital channels for looking at the realities of São Paulo, which reality are you talking about? So that's the question here. And of course, if you do kind of like a scatter plot, you see that they are very, very strongly used. The use of digital tools, for this case, particularly which is public services, is very strongly associated with socioeconomic inequalities. So in a way, what I think this brings to us is really that we have to look at the data. I've been saying this as a Janus-faced challenge. So you might know the Janus god, the Roman god Janus, and the interesting feature or characteristic of this god is that it has two faces, as you can see here, and one is interestingly in this picture a bit more visible or a bit more bright here, which is, I think, when talking about the data problem, is the problem of information overload. And we're talking about this high volume of data, unstructured data, how to make sense of the variable, the variability, the 3 V's of big data. So this is what, a lot of people are talking about when they talk about using big data. But I think what is really important to see is that these challenges have the other face of Janus, which, perhaps as important as and not as clearly and explicitly recognized, which is the information dearth, the lack of information actually, which sometimes happen at the same time, paradoxically, as the information overload. And why? Because you have data which lacks spatial and temporal data coverage. So the coverage is very heterogeneous, and then you could have like overload of data in some areas, but lack of data in other areas. Or this data is not integrated really properly into decision-making processes and tools, or this is done in a biased way. So again, you have a lack of information here, which comes from this mismatch from needs and offers. I used to joke with colleagues who work with big data and say like that I am also interested in the no data problem as well as the big data. And I think that's what I would like to show to you today. I think it's perhaps a flip of perspective compared to the two preceding calls and some of the discussions you're having in the workshop that might be welcome, I hope, for you, which is really to look at the data that we are talking about, the new sources of data from the bottom up, from the community up, really. And the question I'm asking, with a lot of my research is can the data production be an opportunity for empowerment and learning, as well as to achieve high quality data? So these are some photos of community-based methods I use in a number of projects here to really look after this question. Can we do high quality data production that can be used in statistical ways and with significance in some of the ways I think my preceding speakers spoke about, or but also can we do this in a way that actually has impact locally to the communities we are working with. So I'm developing this program of research. This is a very loaded slide, but just wanted to point that I'm developing this in a number of programs, really, a number of projects ongoing today, which are related to build resilience, mostly looking at environmental resilience, but also resilience to health risks in a number of countries, like from Bangladesh, Kenya, Pakistan, Nigeria to Brazil and Colombia. But I don't have time to talk to all of about it today, but I would like to give you an example which is, as Alexandre mentioned in the beginning, connected to COVID and connected to how actually citizen-generated data can be helpful in COVID. This comes from this line of research of having developed an approach for community-based generation data, which is depicted here in broad brushes. I will just give you an overview before going to the example, which involves really combining more automated and satellite processing of satellite imagery and the creation of maps with the community. So actually, one of my key questions is to work with vulnerable communities which are invisible. And for doing that, the first thing that we had a lot of uncertainty about, when I started working with marginalized communities, so-called slums, favelas, or barrios populares, that we have different terms around the world for them, is really, that the sampling frames are very unreliable to work with those communities. They are invisible and sometimes invisible in census. IBGE is one of the few that actually has an identification of Islams actually in the census level. But even with these, I think the difficulty and challenge of capturing the dynamics of those communities in official statistics is a real issue. And of course, it backs directly on the indicators of the SDG 11, especially the target 11.1, which is related to the prevalence of slums. So when we started this, we developed the methodology to work with the community. And here is a workflow depicted in this slide that shows that we go from looking at satellite imagery to really community mapping on the ground to produce a sampling frame that is validated locally, which then is used for surveys. In this case, it was a project around the health surveys. So this is the basic idea here, is really use data production as a way of connecting to communities and understanding how can we do this in a way that perhaps we have to adapt our data generation methods, so that they also are sensitive to the needs of communities at the same time as they reflect our needs for high quality data. And the example I would like to give you, it comes from a project, one of these family of projects I was talking about, which is called UBLATAM, which we started last year. It's about understanding risks and building enhanced capabilities in Latin American cities, and has two partner countries here: Brazil, in which you have the Federal University of Rio de Janeiro, and as our main academic partner, but also strong partnerships with this geological survey, CPRM, and CEMADEN, which is a national early warning service in Brazil, and Colombia, in which we have partnerships with Universidad de Antioquia and Colegio Mayor de Antioquia. So in the UK, we are working with the British here, the University of Warwick, and with the British Geological Survey as well. And this project, we are really looking into this contrast, about how to capture risks locally. And we have two study sites or partner communities, really, and they are in these pictures here. You may think it's the same community taken from different places, but actually one of the photos is from Niterói in Rio de Janeiro, and the other is from Medellin in Colombia. You might guess which one is what. I will tell you in the end of the presentation. But they look very similar because, very similar. We have very similar urbanization issues really in Latin American processes, although also different. And on the right-hand side of the slide, we have here the main structure of the project, which I'll not go into the detail, but just to give you an idea of the objectives. We really are doing engagement of citizens to do citizen-generated data, but engaging directly communities to design processes of data generation. And I think that resonates a little bit of our presentations of Frauke before, calling to attention to the data generation processes. So we are really interested to also shape them together with the community. So this is the work package one. And we have work packages for analyzing social spatial inequalities, as I mentioned today, how they are ingrained and embedded into different systems of governance of resilience and sustainable development indicators. And this would help us to recalibrate some of the environmental risk mapping with citizen-generated data. So we are really looking into using this data to produce meaningful information and significant information that can be used to recalibrate systems. And this is all going to kind of like the main overarching goal of facilitating dialogic transformations to a more equitable way of producing resilience to disasters. So these two communities are very prone to landslides. So our main, as you can see, they are in the hilly areas, and our main focus in the beginning was really to study landslide risks. But then, of course, we started the project, as you see, in the end of last year. We have about a year of the project, and in between, we had like our kickoff event in February in Rio de Janeiro, and just after we had, of course, COVID, which changed everything and changed what risk means, and actually what data production also would mean. And I want to show you two examples of changes that we had incorporated and how the citizen-generated data is being used. One of them very close to COVID, and the other at the second impact of COVID, so to speak. The first is in Niterói. As you perhaps know, Brazil, one of the most impacted countries, and as you've seen, the vulnerable communities, the informal communities who rely a lot on informal work, were heavily affected also economically. So the first kind of like action that we undertake was to look at how maps could be useful for the community to cope with the effects of COVID, also preparing in terms of health risks and prevention, but also, for example, distribution of food baskets to people who lost their jobs and lost their incomes and livelihoods. And we did that, and here are some examples of this, the responsiveness. In the left-hand side, you see two maps of the community of Preventório in a hilly area of Niterói. On the top is the map in OpenStreetMap. The map we use the collaborative maps of OpenStreetMap for this before the mapping intervention, and on the bottom you see the current map, which is still being updated actually. But interestingly, we hold this mapping events, which you can see here on the right hand side, with community leaders and residents of Presidentario, and they actually used these maps and found them really useful so that they could organize actions really against COVID. And interestingly, this map then became actually the most updated and most current. That also is being shared now with the Prefeitura de Niterói, with the mayor's office, the city hall in the city of Niterói. And I think this shows a little bit of the responsiveness and how actually we adapt. And some of the people who are here, mapping with us remotely. We did this everything remotely, and usually we would do local mapping, but we did remotely with COVID. They were part of the team, and some of them never used a computer before, not in this way, for mapping. That they have used, of course, smartphones and other things, but have never seen that territory in that way. And that changed a little bit the way they were really thinking about reacting on these issues of COVID. And the other example happened actually 2 weeks ago, very recently. We had similar mapping actions in Colombia, but 2 weeks ago we did have what was feared for a long time. We did have like a strong rainfall in Medellin, which affected our partner community in El Pacifico, in one of the hilly areas very strongly. You can see here one of the photos of the impact. So there was what is called a flash flood. There was a very strong rainfall episode which devastated the community. And interestingly, again here the maps have actually been used to react to this phenomenon in a very interesting way. Today, this is the map that we generated actually, and the community themselves really took the map because it was the most updated map again, and identified very clearly where the damage was specifically. So you can see here, so there is at least a dozen of houses which were completely destroyed really with this landslide, but also it was actually a combination of a flash flood and landslide with some rock falls as well. And then they actually are using this now to negotiate the kind of like recovery of this big disaster for the community relatively, because 25% of the community lost their houses really, and the others are completely unsure about what to do in the future. And they are using the maps and the data in a way because it's precise enough to act as a very solid evidence to think about the recovery process. So with this, I would like to conclude with some final thoughts with these two examples, and I think what they show us really. So one is that we really looking, when we're talking about citizen-generated data, we have to think about this as what I propose to be a transdisciplinary problem space. That means that some of the usual attributes we expect from high quality data, and then I'm looking specifically at high quality spatial data, like completeness, consistency, accuracy, so positional accuracy, and scalability of the approaches that we are talking about when talking about data production. They have to be also complemented by a view on actually how this data can be locally meaningful for in community engagement. So I used to say that we are working here in developing methods that are really in the intersection of these two issues. So at the same time as producing high quality data, we are also empowering locally. And I think the examples show a little bit of both, of how actually we could achieve both things, high quality data and engagement. And towards what I termed, inspired in Paulo Freire, who used a Brazilian educator who coined his work around the concept of generative words. I call the generative data, the data which is meaningful locally and generates empowerment. So with this, I close with these reflections, which is to say, I think what I would like to share with you is that, when thinking about AI and the future of data production, we have to think carefully about inequalities and how they permeate the whole process of data production, and of course the results of what we do with this data as well. And this starts really with the framing of the problem and the collection of the data, which we really have to be very attentive for. And that's why I think we need transdisciplinary research. We need collaboration between statistical offices and social sciences and researchers. I think this has been pointed out before as well, how important it is to have diverse teams, but also to work together towards designing these methods which really fulfill different purposes here. And I think this will really help us to make sure that the question around whether these new data sources are helping us to move towards an empowering city and an inclusive city. I think only if we really take into account those inequalities and design really territorially sensitive methods really in this collaboration, then we perhaps will head more towards that direction. And the last thing is that to see that data generation itself, it's not only a means of producing data for others, but also a means of learning and empowerment for the communities, when you're talking about these invisible communities that are now generating data. So the co-production, well, as you say, and co-design of these data products can as well be this opportunity for at the same time fulfilling these different purposes. So that's the example I would like to share with you, and some thoughts that perhaps are complementary to the discussion today. Many thanks again for your attention, and I'll hand over back to you, Alexandre.
Thank you very much, Professor João. This is an amazing research and really very relevant for countries in Latin America, and as you have well demonstrated in Brazil as well. So thank you so much for this very interesting presentation. Well, we should have now 15 minutes time to questions, but we are running out of time, and I really don't want to hold you for many minutes. So what I'm gonna do, we have some questions. I would like to invite Professor Lorena and also Professor Frauk to open their camera so that we can make a quick round of final remarks. I will read the questions. Some of them are related to a more Brazilian context, some to Professor Lorena, but what I do, I just read the questions and then I give you 1 minute for final comments and remarks. There is one comment from Mr. Tupam. In the northeast region of Brazil, the Mandacaru project brought together more than 1,000 researchers from various areas of knowledge, collecting data and forwarding preventive measures to the consortium of Northeast governors in the north of Brazil, which made it possible to minimize the damage compared to other Brazilian states. Are there other similar initiatives, and how important it is to work with scientific data for the future confrontation of endemics and pandemics? Another question to Professor Lorena: have you been approached by governments interested in more tailored analysis or insights on their own state or city? How do you think the collaboration between academia and government could be improved? That one was Fabio Storino. Now I have one from Fabio Seni. How do you evaluate the differences regarding mobility data and survey data when it comes to assessing behavior of the most vulnerable population? Is it possible to say that lack of coverage of the poorest population is present in both strategies? How to face those problems? Another one from Eduardo Francisco: how to coordinate the various initiatives of obtained informed based on the territory by the community, by official institutes, by administrative data, by digital crumbs, do you need to have a validator instance of data collected by different instances? This is, in my opinion, very interesting question. Another one from Shamira Ahmed. Does the notion of global north cities, smart cities, that are cut and pasted in developing countries impact your research? So we have a lot of interesting questions, but what I'm gonna do, I will start with Professor Lorena because I'm more Brazilian context. If you can maybe very briefly, Professor Lorena, give your final remarks. It's not need to answer those questions, but if you can give a general remark on the concluding remark on these issues. You are muted.
Sorry, I want to go back a little bit to when we saw, I thought that the opening presentation was really helpful, right? And thinking about kind of, we all see a fuzzy picture, right? And we're all trying to see we're trying all to see the same picture, but we're using different data or different tools and different levels of analysis to try to ask questions. And I think when we're combining and we're learning by combining data, I think one of the things that is important to recognize is that the more data we produce that in alternative formats, the more we're able to challenge and to think about kind of more creatively and outside the box, a lot of kind of traditional approaches to research and to public policy evaluation. So I think the important thing, I think that we're all engaged and we're really committed to is it's very difficult and complex to answer the questions we want to ask. And multiple types of studies, approaches, and research is needed in order to get important answers.
Thank you so much, Professor Lorena. Professor João, final remarks on the issues that were raised.
Yeah, so many thanks indeed for the great questions. I wish I would have time to touch upon a lot of the things, but I think, you know, one of the issues related to vulnerable populations that I emphasized is really, you know, whether surveys are better than other types of data and how actually, you know, you coordinate these processes. I do think that, you know, when you design the survey, you have more control over the processes, so you could have a better understanding. They are more expensive. I think, you know, a combination of different sources, which I think was emphasized by Frauke as well in the first presentation, is really the way to go. But I think, you know, it's really important to be attentive to this to the specifics, you know, because sometimes, you know, talking about compliance, you know, in terms of COVID, you know, like as I think Lorena emphasized, you know, which groups are we talking about? And then, like, it's important to really look at those and as you did, Lorena, and look at what does that mean for vulnerable populations in comparison to other groups of the population. And really, I think that's what the question for me, you know, from the three presentations that stick is really, you know, how actually these new sources of data can be combined in a way which is sensitive to geographies, to territories, and to realities that we are talking about here. I think that's a challenge. It needs coordination. It needs a lot of disciplines and a lot of different actors, indeed. You know, and I think the collaboration of what does validation mean, or how the data is made high quality for some groups and for others, is something that can only evolve through really a collaborative workflow and our processes that involve, you know, multiple stakeholders. So I'll leave it at this.
Thank you very much, João. And I think I do agree that the future of data production is the combination of different methods and different data sources. Professor Frauke, to wrap up all this conversation, what are your major takeouts?
My two colleagues so beautifully referenced that back that I don't need to re-emphasize the point. I think they captured this very well. And so in this last minute of overtime we have, I think it's on me to thank you, Alexandre, and the whole team from NIC.br. I think you did a fantastic job with this conference. The selection of speakers, the coherence of these panels, the way you organize the online setup. We have all been to quite a few online events, and you did a fantastic job. Hats off to you. I think we were lucky that you included us. So thank you very much.
Thank you indeed very much, Professor Frauke. And I'm sure that next year you will be here with us in Brazil in person. And our time, unfortunately, is up for today. But before we finish, let me share with you some statistics of the event, and then I will give the floor to Professor Pedro Nascimento Silva, our fantastic partner of this event and many other projects. But I would like to say that during this week, we had 19 wonderful speakers. I was really very happy with the talking. So 19 speakers, 615 participants registered from 25 countries. First time that we have that variety of countries. I will read very quickly. From Africa, we had Angola, Cameroon, Mozambique, and South Africa. From North America, Canada, Mexico, and USA. From Latin America, Antigua and Barbuda, Argentina, Belize, Chile, Colombia, Costa Rica, Ecuador, Peru, Uruguay, Brazil. From Europe, we had France, Germany, Italy, Latvia, Portugal, Spain, Switzerland, and United Kingdom. This is for us, we are very happy to see that our workshop has demonstrated that much interest. And also, last but not least, I would like to announce that next week, next Thursday, 15th of October, we are going to have a joint webinar with the UN ICLAC in Chile, which is more dedicated to the National Statistical Office. This webinar is going to be on innovation in statistical data production during the COVID-19 pandemic. You are all invited. We can send you the link afterwards. It's going to be 15th of October from 2 p.m. to 4 p.m. GMT-3 Brazilian time. So this is all from my side. Now I'm very pleased to give the floor to Professor Pedro Nascimento Silva. Professor Pedro, thank you so much for your invaluable contribution to NIC.br and Cetic's project on data production. And not only you, but all the faculty from National School of Statistical Science, but more specifically yourself, Professor Denise, and also Professor Maisa. I would like to really thank you so much for this incredible support and this wonderful partnership that we have. You have the floor.
Thank you very much, Alexandre and the team. Thank you, Cetic and NIC.br for the opportunity for us from ENCE to partner with you for preparing this event and our other work together. We have now reached the end of this year's 10th NIC.br workshop on survey methodology. Over the past decade, this event brought us the best there is in survey methodology applied to public and official statistics, particularly in the field of ICT-related statistics. Before the pandemic hit, plans were already advanced for a face-to-face event in São Paulo, which had to be abandoned due to travel and social distancing restrictions. Challenging times for the team. But this is where the fantastic spirit of the NIC.br team came into play. Challenge was turned into opportunity. The decision was made to turn the event into a series of webinars, and here we are. 5 days of learning from the best, with 6 keynote speakers and 12 invited presentations covering the rich set of reflections on artificial intelligence and the future of data production. Over 600 people registered, and we had an average of over 200 people attending every day. Hence, holding the event in virtual format enabled us having not only a broader range of speakers from various parts of the world in comparison to previous face-to-face events, but also a much wider participation in comparison to previous editions, as already highlighted in Alexandre's numbers. The shorter length of time available to the format also challenged our speakers to condense more in less time, which they did with amazing competence. Thank you all. Of course, We would love to have met all of you in person, but this is what is in store for next year, hopefully after this pandemic is over and we may resume other forms of face-to-face interactions. One thing is certain, make sure to keep connected to the NIC.br website for news on their many research publications, capacity building activities, and events. This event's content, video and slides will be made available next week. For now, be safe. See you soon. Thank you all very much. Back to you, Alexandre.
Thank you very much, Professor Pedro. Indeed, we are all looking very much to see all of you in person in São Paulo next year. And now, finally, I would like to give a big thank to all my team from Cetic and also the communications teams at NIC.br that wonderfully prepared all the necessary resources to make this happen. Thank you, everybody. Thank you very much and have a nice day. Thank you.